So
Okay.
I was asked to demonstrate the use of this new 14 millimeter cold snare, the EXACTO MUNDO, it's called, which is a fun name. And it has the same diameter. It's a braided snare, same diameter wire as the regular EXACTO, but a bigger diameter. So we're taking out an SSL here, and you can see the large size of this snare. So I have just started using this. It's just become available. And I think the idea is that there may be a subset of lesions that we would be more likely to get on block, and perhaps a group of lesions that we can take out in fewer pieces. So I'm using the same basic principles of resection here. Resect with a wide margin, push in enough to get the tissue to come up through the snare so that you get clearly into the submucosal plane. But that resection is in real time. You can see it's very quick. We're kind of lacking comparative data. And then one more example of this. This is a granular homogeneous LST in the cecum. And of course, for large adenomas, cold EMR right now has taken a hit because our randomized controlled trials show that the recurrence rate is higher. But in some instances, with a low-risk lesion for cancer, cold EMR might still be attractive. This is a patient with a lot of morbidity, chronic liver disease. And so I elected to do a cold EMR because I thought the priority, in this case, my priority was to reduce the risk of a complication. And so we're using the 14 millimeter EXACTO MUNDO snare, and you can see it's taking quite large pieces of tissue, quite a bit of bleeding. I'm not using epinephrine here, and this patient has pretty significant cirrhosis, and I wish in retrospect I had used some epinephrine. I tend to not use it to limit post-procedure abdominal pain. But so that's just a demonstration of a new snare that we need a lot of data about how well it performs, how safe it is. So far, when I've been using it, I've been trying to get a nice injection mound because snare size is one of the things that can cause us to trap deeper tissue. But it may have an advantage with regard to the efficiency of resection. And that's what I was going to show.
You can confirm that you are treating ulcerated lesion without dysplasia with cold resections. Is that correct?
Yes. Yeah. And in the 10 to 20 millimeter size range, I oftentimes don't even inject them. Just use that basic principle of a nice margin to start, and then accurate snare placement with overlap of the snare in the submucosal defect as you create it. Use the water jet. But with larger ones, I still typically am doing conventional EMR with cold technique.
So probably for larger than 2 centimeter lesions, SSL, this EXACTO MUNDO can be ideally used to speed up the procedure, improve efficiency because you have a little bit bigger pieces, correct?
Correct. Yes, that's the idea. So it's specifically designed now as a cold EMR snare. And I don't think it's got advantages probably for most of the routine cold snaring that we're doing of 10 millimeter and smaller lesions. I would probably use those a 9 or 10 millimeter snare.
Okay. So thank you. Very nice demonstration. Thanks, Doug, for your time.